Welcome, everyone. I'm excited to kick off today's presentation on dual-role transvestism. This is the first slide, so I'd like to briefly introduce our topic. We'll explore what dual-role transvestism is, its significance, and some key insights. We'll cover the definitions, the psychological aspects, and its place in contemporary understanding. Let's dive in and get started. Today, I want to talk about a clinical presentation that can sometimes be quite complex. Imagine a 32-year-old man who comes to see a psychiatrist after his partner discovers several women's outfits. This initial detail raises some questions about what might be going on. He admits that he dresses as a woman occasionally, and he explains that doing so helps him feel like the opposite sex for a while. It's important to note that he does not experience sexual arousal during these episodes, nor does he have any desire for permanent gender change. This distinction is crucial because it helps differentiate between different types of gender-related behaviors. His main source of distress isn't the act of dressing itself, but rather the secrecy involved and the tension it creates in his relationship. This highlights an important point. The emotional and relational impact can often be the most significant aspects of these presentations. Connecting this to our overall theme, it's essential to understand that such behaviors can be motivated by various psychological factors, and the distress often stems more from internal conflict or external pressures than from the act itself. Recognizing these nuances is key to providing appropriate support and treatment. Let's take a closer look at the definition of dual-role transvestism, which is classified as F64-1 in ICD-10. This condition involves episodic cross-dressing, meaning the individual dresses in clothes typically associated with the opposite sex, but only temporarily. The key point here is that this behavior is usually short-lived and not constant. Importantly, there's no sexual motivation behind this behavior, so it's not driven by sexual arousal or desire. Additionally, there's no persistent wish to undergo a permanent sex change. Instead, the cross-dressing serves a specific, often temporary, purpose, like experiencing a different gender identity for a short period. Recognizing these distinctions helps us understand that this condition differs from other gender dysphoria or transgender identities, focusing more on temporary exploration rather than long-term identity issues. This concept ties into the broader theme of understanding diverse, gender-related behaviors and differentiating between them for accurate diagnosis and support. Let's talk about the mechanism and phenomenology behind this experience. Essentially, it represents a temporary role or identity exploration. It's like trying on a different role or persona for a while, which can be a way for individuals to explore different aspects of themselves. This process often acts as a form of experiential role play or emotional regulation, helping people understand their feelings or manage emotional stress. It's not necessarily about permanently changing who they are, but rather exploring different facets in a safe and temporary way. It's important to distinguish this from conditions like gender dysphoria or paraphilic transvestism. These are different experiences with different underlying factors. What we're discussing here is more about a transient, exploratory phase rather than a persistent or distressing identity issue. Understanding this helps us see how role exploration can serve as a healthy, adaptive process rather than something pathological. It ties into the overall theme of how identity and experience can be fluid and context-dependent. Let's talk about the clinical context and occurrence of this phenomenon. It may often appear during cultural, theatrical, or private role-play situations. This means that individuals might experience or demonstrate these behaviors when engaging in activities that involve role-playing or performance. More commonly, however, it's discovered after family conflicts come to light or during gender evaluations. In these scenarios, it's usually brought up as part of a broader assessment or conversation about identity and expression. Understanding when and how this occurs is important because it helps us recognize the situations in which these behaviors might emerge. It also emphasizes the importance of a sensitive and thorough evaluation, especially when conflicts or questions about gender identity are involved. So overall, this slide reminds us that these behaviors or expressions often come to light in specific social or personal contexts, and being aware of that helps us approach these situations with empathy and understanding. Let's take a moment to explore the concept of associated distress and its consequences. First, it's important to understand that the behavior itself is not inherently pathological. What often causes concern or distress isn't the behavior alone, but rather the feelings or reactions surrounding it. For example, secrecy, guilt, stigma, or strain in relationships can really amplify the emotional impact. These factors can make someone feel isolated or misunderstood, which in turn worsens their overall well-being. Another critical point is the potential for misclassification. If we don't accurately understand what's driving the behavior and the distress, there's a risk of causing unnecessary harm or confusion. Labeling something as a disorder when it's really a response to external pressures can lead to more stigma rather than support. So, it's essential to look beyond just the behavior and consider the underlying emotional and social factors. Connecting this to our overall theme, it reminds us that a compassionate, nuanced approach is key to helping individuals navigate these challenges without unnecessary judgment or harm. Now, let's discuss some important exclusions and how we differentiate these conditions. First, if cross-dressing is primarily sexually motivated, then we're looking at transvestic disorder, which is classified as a paraphilia. It's important to recognize that in this case, the behavior is driven by sexual arousal rather than a desire for gender identity change. Next, if there's a persistent desire for a permanent change in gender, then the diagnosis leans towards gender dysphoria or transsexualism. This distinction is crucial because it highlights the underlying motivation. Someone with gender dysphoria genuinely experiences a deep-seated incongruence between their gender identity and assigned sex, not just a temporary or sexual curiosity. Understanding these differences helps us avoid misdiagnosis and ensures that individuals receive the appropriate support and treatment. Remember, the key is to look at the motivation behind the behaviors and feelings, whether they are driven by sexual factors or a core gender identity incongruence. This clarity is essential in our overall approach to diagnosing and supporting our patients effectively. Now, let's talk about the management approach. First, it's important to emphasize a non-judgmental and exploratory assessment. We want to create a safe space where the individual feels comfortable to explore their feelings without fear of judgment. This allows us to better understand their experience. Next, clarifying the motive is crucial. We need to distinguish whether the feelings are driven by arousal, role experience, or perhaps discomfort with their identity. Understanding the underlying motive helps guide the appropriate support and interventions. In cases where distress arises, supportive psychotherapy and couple counseling can be very helpful. These approaches provide emotional support and help address relational aspects that may be impacted. Finally, we refer to gender services only if the individual consistently experiences dysphoria. It's important that this isn't a temporary or situational feeling, but a persistent and genuine sense of discomfort with their gender. Overall, this approach ensures we provide respectful, thorough, and tailored care, aligned with the overall goal of supporting the person's well-being. All right, let's take a closer look at this mnemonic, ROLE, which can really help us remember some key features of this particular behavior. Think of it as the actor borrows a role for a show, where each letter stands for something important. R stands for renders a temporary opposite-sex role. So, the individual adopts a role that's not permanent, often for a limited period. O is outside sexual motive, meaning the motivation isn't necessarily driven by internal sexual desires, but could be influenced by external factors. L indicates lacks desire for permanent change, so this isn't about a long-term identity shift, but a temporary exploration. Finally, E is episodic and enjoyed, highlighting that these episodes are often short-lived and can be pleasurable or at least engaging for the person involved. This mnemonic helps us quickly grasp the main points about this behavior pattern, especially when considering how it fits into the broader context of gender identity and sexual behaviors. Remember, it's about temporary role-playing episodes rather than permanent identity changes. This connects to the overall theme of understanding the different ways people explore or express their gender and sexuality in a variety of contexts. Let's look at a key exam note here. When you're analyzing this behavior, a crucial clue is that it's a temporary form of cross-dressing, and importantly, there is no sexual motive or desire for gender transition involved. This helps differentiate it from other gender-related conditions. In ICD-10, this is categorized as F64-1, which is known as dual-role transvestism. However, it's interesting to note that modern classifications, such as ICD-11, have moved away from pathologizing these behaviors altogether. They recognize that such cross-dressing, when it's temporary and without sexual intent, doesn't necessarily indicate a mental disorder. So, understanding this evolution in classification is important when you're thinking about how these behaviors are viewed today versus in the past. This slide ties into the overall theme of how our understanding and diagnostic criteria for gender-related behaviors continue to evolve, emphasizing a more nuanced and less stigmatizing perspective.